Okay, now we're going to look at what if you had a question that allows multiple responses. Because so far we've been looking at variables with only one value, but a variable could have multiple values. So sometimes we have surveys and you ask a person to check or to tick all that applies, and it could be 1, 2, 3 or more different responses that you could get, and you could have different combination of responses. So something like that would be a little bit difficult to code for. So if you look here at this data set that we have expanded a bit, so for example, there was a question on a patient tool or patient record that was asking, what are your current symptoms? And the current symptoms are vomiting, shortness of breath, cough, and fever. So if a person only has vomiting, then they would indicate vomiting. If a person has all 4, they will indicate all 4. If a person only has 2, they will indicate which 2. If a person has 3 or so, they will indicate which 3. So how do you code for that? So what we could do, one of the strategies that I'll be explaining to you, is that for each value, you create a variable for it. So create a variable for vomiting, a variable for shortness of breath, a variable for cough, and a variable for fever. So when you look at each case or each patient, so this patient here had vomiting, so because vomiting is present, we give them a 1. The other symptoms were absent, so we assigned zeros. This next person had all 4, so they get a 1 for each of the symptoms. And if you look at this person that has only 2, vomiting and fever, then for vomiting they got 1, and for fever they got 1, but the others they got 0. Right? So 1 will indicate that the symptom is present or that option was selected. And you could do that for all of them. And then what you could also do at the end of that, you could compute and you could add up all these figures to get the number of symptoms. And then this number of symptoms, you could use that to say, boy, how many patients showed 4 symptoms, how many patients showed 3 symptoms, 2 symptoms, 1, how many patients probably had none if that was the case. So you could look at it like that. Or you could use it and develop categories. Patients with 3 to 4 symptoms or patients with less than 3 symptoms. You could do a lot of different things with the data after that. So for situations like that where you have multiple responses, this is one of the methods that you could use to code the data and account for it. And even like this now, it will be easier to tell what percentages of patient experiencing vomiting or shortness of breath, coughing, and fever. Alright, and you could also do other techniques. I could look at what percentages of patients had both vomiting and shortness of breath, and so on. So this is how you could code for data with multiple responses.